How do you think the Choosing Wisely campaign has affected management of chronic urticaria patients?
Well, I think it's a great campaign because it's looking at trying to reduce cost in allergy and medicine. And part of this chronic urticaria campaign was influenced by an article I wrote a couple years ago where we looked at 356 patients who had chronic urticaria. In these patients, over 1,800 lab tests were ordered, but only 319 were abnormal. Of these 319 tests that were abnormal, surprisingly, only 30 had further follow-up laboratory test obtained or referral to their physician. And the end result, which was most surprising, is that only one patient out of the 356 actually had a change in management of care from all of this laboratory work. So it sort of shows that when you evaluate patients for chronic urticaria, despite doing a lot of laboratory tests, it rarely influences overall care.
And how do you think Choosing Wisely can benefit patients in the future?
Yeah, I think it benefits patients because it helps you to keep in mind you've got to look at kind of when you order a lot of these laboratory tests from a more cost-benefit standpoint. So that's something you always need to keep in mind, especially with the cost of healthcare.
What is your take-home message for primary care physicians and allergists?
I think the take-home message from this study kind of goes along with what the latest and soon-to-be published practice parameters for guidelines for chronic urticaria is, which is you need to limit the amount of tests you're ordering, especially in a patient with chronic urticaria who doesn't have a history or physical exam that has significant findings. The soon-to-be released guidelines are saying you only need to order 4 tests. Which includes complete blood count, liver function test, thyroid test, and erythrocyte sedimentation rate. So those 4 tests are less than the average in our study, which was 6, so that's an improvement.
Where do you think the research in chronic urticaria is heading in the future?
Yeah, well, I think a couple things I can encourage. You can always have more tests evaluating kind of cost-benefit of doing extensive laboratory testing, especially from a prospective standpoint. Nearly all the studies have been retrospective. Beyond that, I'm sure in the future we'll try to come up with some more novel biomarkers that you can better see how chronic urticaria can be managed and treated.
Thank you.
Thank you.